Okay, hi, I'm Shelby. I am a nursing student at Butler Community College. Today, me and Chester are going to be doing patient transfers. So with this, I always say definitely wear gloves because surprises happen and you don't want to be not prepared for a surprise. Definitely a gait belt. The gripper socks, make sure they have those on. And if they use anything to ambulate with, like a walker, a cane, anything. And definitely read the orders, make sure they're not a two-person, one-person, just to kind of figure out what level of assist they are. Chester here is obviously skin and bones, so he's going to be a one-person transfer today, and he does not have any ambulating tools or anything like that. He does have an arm injury and a C-spine collar on, and then he does have a leg injury, so he's kind of banged up, but we're going to do what we can. So I always go into the room, introduce yourself, always do hand hygiene before you walk in the room, foam in, foam out. And then, like I said before, wear gloves, just because you never know what's going to happen and what you're going to walk into. So you walk into the room, introduce yourself, do 2 patient identifiers, make sure that you're with the right person, because it's happened. But yeah, just make sure you're with the right person. You want to start by making sure, like checking their range of motion and their strength, just to make sure that they're actually with it enough to get up and get around. For this demonstration, we're just going to be doing it's kind of like a stand pivot. So they don't really, a lot of times they're not as mobile. So it's just something that we learn to do to make it easier for them so they're not just stuck in bed. So a lot of times, like I said, it's with immobilities, things like that, but either to a wheelchair, we're just going to do a regular chair today. So, but yeah, patient transfers, you just really have to think about yourself, the safety of yourself and your patient, because if you hurt yourself, you're going to be hurting your patient. Like, no matter what, it's going to happen. So just make sure that you are able to do it as well. If you don't feel comfortable or confident picking this person up and putting them in a chair, then get someone to help you, because it's always, like I said, better to be safe than sorry. So we're going to come into Chester's. So he is laying down. I come in, introduce myself. My name is Shelby. I'm going to be helping you get into your chair today. So he is laying down. So a lot of times, most times patients are going to be laying down, what I like to do is raise the head of the bed, get them kind of in a sitting position in the bed, just so it's easier for them and you. And then getting their legs and having them kind of turn towards the front so that their legs are hanging off. Let me see if his knees will bend. Okay, and then at this point, I always like to just sit for a few seconds just so they can get their bearings. Because a lot of times just getting up really quick can make you a little bit frazzled and that kind of thing. So just give them a couple minutes just to relax if they have vertigo, anything like that. And so have them sit on the edge of the bed, still close enough where they can touch, but then also just so they feel safe. And then, so what we do next is we will put the gait belt around them. I am just using a regular belt, so I do not have a gait belt. So we're going to be using a regular belt. So we would put it around him or her. And then, it's not going to stand up. And then you tighten it. Tight as it needs to be. Tighter the better. This is as tight as this is going to go. And then you push it through. And then what I like to do is I like to tuck the edge in. So then we're at this point. So with the gait belt, you just have to be careful, because if there's any chest tubes, you need to go over it. Or if there's anything in this part down, you need to go above it. If any other reason, definitely stay mid-waist, kind of like right here. Definitely just giving it a really tight grip. Also make sure that their back is covered. He does not have a gown on, so I can't cover his back, but just to make sure the back is covered, just so that because they're usually plastic, so it's definitely uncomfortable. But yeah, and just to kind of take into consideration all of his injuries. So, all you would do, I'm going to get a little lower just so you can see. Okay, so you want to have proper body mechanics. Always bend at the knees, not the waist. What I like to do is I like to do kind of like this. Put my knees on their knees, like that. And then you grab the gait belt. Down here now. You grab the gait belt. And then you go up. Have them kind of stand for a second. Do what you need to do. Okay. Sorry. Stand up. Do what you need to. Let them calm, like kind of relax so they don't get dizzy or anything like that. And then you just turn. And then you just sit them down like this. And then that's really all you have to do. Just try to make sure you keep proper body mechanics on you and also the patient, just so it helps kind of both of you. Like I said, always bend at your knees, never your waist or anything up above that, pretty much. And then always make sure to have a pivot. So you just kind of do a little spin. You don't actually like kind of turn your back, because that'll give yourself a back injury. Also with the patient, just make sure that, I always like to make sure that they're close enough where the back of their legs can feel the bed or the chair, whatever you're putting them in, just so that helps them sit better. A lot of times, whenever you're getting them up, the gait belt is the best way to do it, just because you can pull and then kind of help them pull up. Another thing I like to do is kind of give them like a 3 count, like a 1, 2, 3. So then a third, you can kind of pull them up and it gives you the momentum. But yeah, always have the gait belt right here. Unless there's a chest tube, then definitely go above that. A lot of times, the little bit more of a bustier woman, they also like to kind of go above it, not underneath it, just because it can kind of push everything up. But yeah, it's, as long as you do it correctly, it's going to be very safe for both you and your patient, and it'll definitely help them in the long run. So yeah, and just make sure they either have shoes or the grippy socks on. And if they're a lot bigger or you don't feel like you can get them yourself, definitely bring another person, just because it's a lot easier and it's a lot safer for both of you. And then whatever you're transferring them into, make sure they're comfortable. Make sure they have what they need, like before. You definitely put the call light within reach, the little side table, if they have the side table for meals, or anything like that, just to make sure that they're in a good spot before you leave them. If you're in a wheelchair, you transfer to a wheelchair, always lock the wheels on both sides, just because you don't want them wheeling out below you. And then if you have a patient that has one-sided weakness, always stay on the weaker side, just so you have, so that you're there to kind of help them, because their strong side doesn't necessarily need as much help as the other side. So definitely in that case, you want to stay on the weaker side. And yeah, always use a gait belt. And like I said before, use gloves just in case there's a surprise. At the end of this, just ask them any questions, ask them if they need anything. And then if not, just let them hang out. Some patients sometimes need a chair alarm, just so that we know when they get up. So definitely put a chair alarm on if they need it. But if not, they'll just let you know. So yeah, that's all you gotta do.